Well, today on the show, we're visiting with Christopher Stanford at Lakeview Nursing and Rehab Center. It's on Robinson Road in Gulfport. How you doing, Christopher?
Hey, good to see you again, Jim.
Yeah, it's good to see you. See, I had to be like you.
You know what? You're getting the memo. That is good. God only made a couple heads perfect. The rest he put hair on. So, we got those perfect heads. There you go.
We got that covered. Well, let's talk about Lakeview here on Robinson Road in Gulfport. Tell us about the center.
Lakeview Nursing Centers and Rehab Center, we've been here for about 10 or 15 years. We're a 105-bed facility. Now, out of those 105 beds, approximately 75 to 80% of those are long-term care, which means, for all intents and purposes, that the residents live here. Mm-hmm. Now, the other 25 to 30 beds, those are rehab beds, and primarily that's what we're going to concentrate on some today. We have residents that come for fractured knees, hips, shoulders, recovering from stroke, things like that. So
right.
It's nursing and full rehab.
And there's different parts of the rehab center. I mean, they have occupational rehab.
Correct.
They have physical
therapy, speech therapy,
and
PT,
all that.
ST, OT, any of the T's you pretty much name, we've got covered.
They're going to get you up and going whenever you do.
Correct.
So, but before they do that, they got to feed you real good. And
good point.
Me and you, we both like to eat. So
if you're going to be like me, we certainly got to eat. So how about we go to the kitchen?
Let's go to the kitchen. Come on. Oh, they must have knew I was coming. They got wings. One of my favorite foods. Ben Thigpen is the chef here. How you doing, Ben?
Doing well, Jim. How are you?
I'm doing well, thank you. Now, as the chef here at Lakeview, you tell us about the importance of the proper nutrition and diet for the patients here.
People eat well. They're happy. They feel better. You have a lot less weight loss. Their health is better all around.
Mm-hmm. And of course, you do have those that are on particular diets because as requested by their physicians, and y'all follow that real well.
Yes, we try to. You have a special request from time to time, but we always meet them.
And it looks like from some of the food that you got. I mean, I see some baked chicken, some rice, and of course the wings and carrots, and of course they're cooking up more back here in the kitchen already, and they get three regular meals a day and snacks and everything.
We do 3 meals a day. We do a room service menu that we're putting in place currently, so they can eat throughout the day. We do special birthday meals to celebrate people's birthday. They can have whatever they want, steak, lobster, we get it. So.
All right, and always something different throughout the week. So again, once you come in here and they eat, well, might have to go work that off a little bit. So we're going to walk back to the physical therapy department then. Thank you so much.
Thank you, Jim.
Now, LaWanica is one of the physical therapists here at Lakeview. How are you?
I'm good. How are you?
It's a very pleasure to meet you.
Nice
Tell
to
us
meet you
about
too.
some of the things that you deal with here.
We deal with patients ranging from orthopedic surgeries to neurological disorders and just any type of disorder or illness that brought them to the hospital and they can't return to their prior level of function. And we just kind of focus on getting their legs strengthened, getting them back to walking, really focusing on correcting those gait deviations that they may have had due to their recent illness.
So like strokes and things and
exactly,
hip
total hip replacements, things like that. And we really just kind of, we get them in the parallel bars, work with them in the stairs, just whatever they need us to work on, that's what we work on, because our main focus is meeting their goals.
Mm-hmm. And then getting them back into
their prior level.
Their prior level. That's great. And one of the great things, too, as I mentioned here at Lakeview, is they have some different levels of therapy. I mean, you handle physical therapy, and they also do occupational therapy. So let's talk to Ginger about that. Now, Ginger is their occupational therapist here at Lakeview, and tell us some of the things that you deal with, Ginger.
We try to get our patients back to a level of function that they were prior to their deficits. Sometimes that's by adapting their environment at home, making modifications. We educate the family members and keeping them as independent as possible when they go back into the home, while particularly focusing on what's most important to the patient also.
And it could be simple things like, getting up and down out of a chair, or?
Getting up and down out of a chair, getting to and from the bathroom areas, dressing, just little tasks that you take for granted every day.
Getting stuff out of cupboards.
Right, people cooking, they need those.
So a lot of it has to do with the motor skills and everything that you deal with.
Exactly. We do a lot of, shoulders and hands, and
it's just a lot of different coordinating things too. So
it really is.
Okay, all right. Well, thank you. And one of the other things that they sometimes have to deal with is speech therapy, which is having to be followed by stroke. So let's talk to Stephanie. Now, Stephanie is the speech therapist here at Lakeview, and tell us some of the things that you work with, Stephanie.
Okay. In speech therapy, we work with a lot of different types of disorders and deficits. We can do cognitive therapy with our patients that have dementia, and then also with those that are kind of higher level patients. They might just have some mild short-term memory or cognitive impairment. We really try to help those patients regain that independence for going home. We teach them how to manage their medications, their finances, and really do some higher level problem-solving tasks. We also work with patients with language and communication problems. Maybe they've had a stroke, or they have aphasia, and they just lose that ability to communicate their wants and needs. So we try to help them come up with strategies to be able to communicate those things. And then also we specialize in swallowing therapy. We call that dysphagia. Both of our speech therapists here are VitalStem certified, so we use that along with other modalities to help them regain that function and figure out the safest diet for them to be on.
Because I guess it kind of goes back to where we were in the lunchroom, is knowing what this particular patient can do as far as, yes, they can have solid food. Know that they are on a liquid diet.
Exactly.
It's very important.
A lot of our swallowing therapy is done during mealtime to make it very functional for them, and teaching the nurses and the staff exactly what strategies to use with that patient to make it the safest time for them, for those patients.
Wonderful. Thank you so much.
Problem.
Well, as we mentioned, Lakeview does have 105 rooms here, and we're going to check out one of them that's really decorated nice. One of the things I noticed, Christopher, when you come in here, I mean, this is really a nice room, one of your regular occupants, but everybody is seems so upbeat and happy. I mean, the ladies behind the nursing stage, nursing centers and everything, they're all smiling. All the people that are, your patients or occupants are, they're smiling and happy and almost having wheelchair races down the hallway.
For us, it takes a certain individual to care for the elderly. And as we mentioned earlier, we have long-term care and rehab. We focus mostly on the rehab side, but on the long-term care side, we look for employees, and I basically ask everybody who would come in this question: how do you take care of your residents? And if their answer is, we take care of them like it's my own mother or father or grandmother or grandfather, then they're the right candidate for us. And then if you go in with that perception and that agreement, then everybody's there. So that's our approach, and we want to be a step ahead of it.
Well, you do. Whenever you're walking through, you see they are actually treating people that way. Wonderful facility here. Thank you so much for having us out here.
Visit with us.
If you want some more information, call the number on your screen. They're located on Robinson Road, and come out here and take a little tour. And perhaps you might have some need for them out here at Lakeview. Wonderful facility, Lakeview Nursing and Rehab Center.